Thank you, Madam Speaker. Question number 28 of 2017, which is under my name on today's order paper, is directed to the Minister of Health and Medical Services. The question is, can the Minister inform the House on what were the actions of the Ministry in regards to the fish poisonings and eventual deaths report on Gau Island in Lomaiviti?
Thank you.
Thank you, Madam Speaker.
Health and Medical Services. Thank you, Madam Speaker, and I thank the Honourable Member for the question. Madam Speaker, please allow me to say that it was really an unfortunate start to the new year with the unfortunate incidents of fish poisoning where 4 lives were lost. The 4 lives lost were due to what we now is confirmed as Ciguatera fish poisoning. If I may inform the House about what that fish poisoning is and how it occurs. Ciguatera poisoning is a form of fish poisoning that is caused by eating fish that has Ciguatera toxin. Ciguatera toxin is produced by dinoflagellates, being small marine organisms that live on or near coral reefs. These marine organisms may attach to seaweeds, corals and algae in warm seawater ocean reef environments. Small herbivores fish eat algae that have Ciguatera toxin, and the potency of the toxin increases as it accumulates up to the predatory food chain with very high toxin levels present in bigger reef fish. Many species of reef fish have been known to cause Ciguatera poisoning in humans. The toxin does not affect the appearance, odor or taste of the fish and is not destroyed by cooking, refrigeration or freezing. Madam Speaker, here we have a list of all those fish species that are known to have Ciguatera poisons, toxins, and this is one of the information charts that has been used by the Ministry of Health and in conjunction with the Ministry of Fisheries in informing the public about what fish to eat and what fish not to eat. Coming back to the 4 deaths on the island, again, like I said, it's very unfortunate and regretted. In total, we lost 4 lives, and about 17 people were affected who have since then recovered from this poisoning. Medical help was sought for a number of people with suspected fish poisoning from eating the fish that we know now as Daniva fish. Madam Speaker, after that, 2 more cases were reported from Ba and Votua village, and fortunately for us, they sought medical assistance very quickly and they were treated and have since now recovered. Since the moment this issue was brought to the attention of the Ministry, as I mentioned the House yesterday, our medical officer based at the health center was in Suva and had accompanied a sick child to CWM, and the nurses and the team acted promptly to ensure that no further lives were lost. We promptly deployed a medical and public health team from Levuka to be stationed there, and they carried out visitations to the villages around to follow up on the affected villages, and they provided further medical treatment and further advice to the villages on the signs and symptoms of fish poisoning and other preventative measures. Any patient who appeared to be at a risk was carefully monitored and treated, and like I said, have since recovered. At this point in time, I commend and acknowledge the 2 nurses based at Garani and Nawaikama nursing stations who responded in very timely and a professional manner in treating all the villages that were affected by the Daniva fish poisoning, even though our medical officer was not present there. And Madam Speaker, at this point in time, I would also like to put on record my appreciation to all our doctors and nurses and all health medical staff throughout the country. They walk through good times, they walk in challenging times, they walk in difficult times, and they walk in remote environments. But at all times, we have to ensure that all our Fijians have access to the care they need, when they need it, and the public can be assured of that. We will do everything within our means, within our capacity, to provide services to our fellow Fijians. The Ministry of Health and Ministry of Fisheries, Madam Speaker, has continued to bring awareness on fish poisoning prevention. We've also used the social media and the media to create awareness and communicate with messages to the general public on fish poisoning prevention. In terms of the Ministry of Health, our team was advised to and updated to inform their clientele on what needs to be done and how these fish poisoning cases could be detected. And there are measures taken like awareness programs, and we'd like to plead to the public that when information is given, they need to take heed of this, and should they see that they would be suffering from any form of fish poisoning, they need to report at the earliest to the nearest health centers for any preventative measures. Madam Speaker, other information that I would like to bring to the House, like I've said, Ciguatera fish poisoning. The common features in a fish, for example, in herrings and sardines, which are commonly used as baits, that suggest that if it may have poisonous toxins, these fish may have distinctively red and swollen eyes. It is encouraged that fish is carefully scrutinized for unusual features that may suggest the possibility of toxin presence. And in terms of the effects of fish poisoning, Madam Speaker, symptoms usually occur within 2 to 24 hours. However, we have had cases reported to occur as early as 15 minutes of eating any poisonous fish. I'm sure somebody is going to ask me this, what are the symptoms of that, so please let me tell you before you ask. A person with fish poisoning may have vomiting, common case of vomiting, diarrhea, abdominal stomach cramps, headaches, fatigue, fainting, joint and muscle pains, tingling around mouth, fingers and toes, burning sensation or skin pain on contact with cold water, extreme itchiness, or can become unconscious in severe cases. It is recommended once again that anyone suspected or shows symptoms of fish poisoning seek immediate medical attention. There is no cure or specific antidote for fish poisoning, although the supportive treatment can be provided and most patients do fully recover without any serious complications. Thank you.
Supplementary question. I haven't given you the floor yet. All right, Honorable Noikula, you may have the floor.
Minister, please. Sorry, Minister. Can the Honorable Minister please inform the House whether the Ngarani Health Center was stocked with the right medicine to fight this toxin? And if yes, why did they die? If the health center was not stocked with the right medicine to fight this toxin, why wasn't there in stock? Because it's prevalent in any coastal county. I can repeat it. Okay.
Just repeat.
Can you please explain if the Ngarani Health Center was stocked with the right medicine to fight this toxin? And if yes, then why did these 4 people die? But if it wasn't stocked, then why not? Why wasn't it stocked?
Honorable Minister.
Yeah. You are talking about stocking of the medicines to cure that. That was not the reason. Sorry, I don't know where you got the report from, but sorry, Madam Speaker. When this incident happened, there was a lot of reports that came in the media. Some were actually substantiated by facts, and we did manage to clear the air with all the media stations, both the print and the TV. And what came out was that the patients did not die because there was negligence on the part of the ministry. And there is no report to state that our health centers were not stocked up with the medicine. That's why we managed to save the other villages. What I gathered from the report was they presented very late to the health centers. And that eventually led to the death. But those that presented themselves early to the health centers, they were looked after, they were treated, and they recovered. Thank you.
Thank you. I now give the floor to the Honorable Mandi.
Thank you, Madam Speaker. I know that this is not the last time for fish poisoning in our country. I will ask the Minister, has the Ministry conducted some research on the use of traditional medicine to cure the fish poisoning in maritime islands or remote areas where they cannot be accessible to medicines, modern medicines? Thank you.
Honorable Minister.
I do know. Thank you, Madam Speaker. I thank the Honourable Member for the question. Well, to answer your question straight, Honourable Member, we have not considered that option. But we are aware that many communities, villages and individuals have their own ways of testing whether the fish is poisonous or not. But as part of the medical facility, we encourage people to not take that risk and be sure of what fish is to be eaten. But like you said, that is something that we can consider. If it works for people, then we'll consider. But at the moment, we haven't considered that.
I give the floor to the Honorable Nawoka.
Thank you, Honourable Speaker. Honourable Speaker, the species that the Honourable Minister had displayed have some fish that some of us didn't believe were poisonous. I mean, I love fish. Some of my favorites are in there, and I was ignorant of this. And I wish you good health, okay? But that is an indication of the danger in this, Madam Speaker, that the level of ignorance is quite high in this country about what is poisonous. So I would ask the Honourable Speaker to lift the level of awareness, whether by TV or radio or by newspaper, because that is, I think, the first time some of those species have been identified as poisonous. Thank you. So really, I mean, how far can you go in terms of creating awareness? Thank you.
So you've given me an extra role, Honourable.
Sorry, Madam.
You have given me an extra role. Maybe you will want to.
I've given her.
You told the Speaker,
yes,
to increase the awareness.
Oh, for the.
Oh, thank you.
I would ask the Honourable Minister to how much more she can go to in terms of creating the awareness, because the way I look at it, it can be, this is a national emergency.
Thank you.
Thank you.
Minister.
Thank you, Madam Speaker, and I thank the Honourable Member for that concern. I'm sure we are all concerned about our communities, and I can assure the Honourable Member and the Honourable House that I will go along all the way with the Minister for Fisheries to ensure that we raise the level of awareness. This morning during conversation I was informed by the Minister for Fisheries, these are all over the places, the fish markets with communities, but I think, like you said, it's not enough. We really have to uplift our level of awareness to ensure that people do not consume this. Thank you.
Thank you. I give the floor to the Honourable Akbar.
Thank you, Madam Speaker. Supplementary question. This fish species, the niva, has never been known to be poisonous. And this is probably the first time in the history of Fiji that it has been poisonous. I want to ask the Minister, because this fish is not in the list of poisonous fish under the Fisheries Department. Well, this is a one-time only incident, or it will be listed as one of the poisonous fish species. Thank you.
Thank you. Honourable Minister.
Thank you very much. Honourable Member, I don't know what list you're talking about, but I have been told by my colleague here that it's part of that list. And you're talking about Daniva, okay? So I think it's the point here is for us to create awareness amongst our communities not to eat that. And then I cannot guarantee you whether it's a one-off thing or a long term. I'll have to ask some experts and I'll get back to you. Thank you.
Honourable Minister for Fisheries, would you like to add to the answer?
Madam Speaker, the list that has been published in the daily papers and also in the blog sites include Daniva also. So I'm not sure if the Honourable Member has read his list, or maybe it's a different list that he can read. He cannot read.
Thank you. I now give the floor to the Honourable Karwaki. Not Chako.
Madam Speaker, I was just indicating that charcoal is the natural remedy for poisoning. Whether the Ministry of Health would consider also recommending or working together with the use of natural remedies to complement the medical treatment that is given. Because in this case, Madam Speaker, if they were told to use charcoal right then no one would have died. No one would have died, Madam Speaker. And I would just ask the Honourable Minister if she could take that into account and consider also working together with those that work on natural remedies. Thank you, Madam Speaker.
Thank you. That was not a question, it was a statement.